My name is Kevin Majewski. I'm the administrator for Cyberknife Centers of Tampa Bay. We have two locations, one here in Brandon and the other in Town and Country area of Tampa. Cyberknife is a radiosurgery tool, and we treat cancer patients of all types really, brain tumors, prostate, lung, pancreatic, metastatic breast, not primary breast, but metastatic. And it is a tool that a group of doctors have brought to the community to serve those members of Tampa Bay that they truly believe in. So we are owned by a group of 6 physicians who have external beam practices in Brandon and in Pinellas County, and they've brought this technology to the Tampa Bay area to benefit those patients who ordinarily wouldn't have access to that type of treatment. The technology is amazing in the sense that we can accomplish in 5 days what a patient would normally have to experience in 45 to 50 days at an external beam setting. This is Osmond Dongas. He's our chief therapist here at our Brandon site.
Hello.
So Osmond monitors the patient's treatment from start to finish, and this is the tech area where he would normally sit. For this computer here, we have 2 rows of images. We have 2 cameras in the vault that we'll see shortly, and they take a live image, and we compare that to a previous image that we've done with a CT or MRI that our physicist, Dr. Shao, has worked with the doctor for a treatment plan. And we also have audio-visual, for legal reasons and safety purposes, so we can see and talk to the patient the whole time. This particular patient we're going to see is set up to simulate a brain treatment. It's a head phantom, and we'll get a little bit closer here in a minute. So the lasers you see in the patient, those are stationary lasers that are coming out of the side walls, and we use those just to line the patient up. Normally, a brain patient would have a setup like such with the headrest, and we make a thermoplastic mask that holds their head stationary during the treatment. It's more or less a reminder. Patients really like this. It's much different than the setup for a Gamma Knife, where the mask is actually bolted into the patient's skull, and it has to be performed all in one setting because it's bolted onto the patient. So they call that a fixed system. This can be removed if the patient has to use the restroom in the middle of the treatment. We just come in, we pop it off, they get up, use the restroom, come back, we put it back on, we take a couple of x-rays to set up, and then we resume treatment as usual. So not only does it allow us to do that, but we can fractionate it, which means we can spread the treatments out. Instead of doing it in one sitting, we can do it in 2 or 3, which is much easier for the patient to tolerate. This is the Cyberknife machine. From here back, it's just a robotic arm. It's the same robotic arm that BMW and Mercedes use in their manufacturing plants. On that robotic arm is mounted a linear accelerator, which is this apparatus right here, and the radiation is electrically produced, and it comes out of this part of the machine. Now in just a minute, this is going to start rotating around and going to the various treatment angles. No radiation is going to come out, obviously, because we're in the room, but you'll see how that actually moves. And this is exactly what the patient would experience. They would come in, lay down on the table, we would put that mask system on that I showed you earlier, and we would line up to the patient's bony anatomy, and then Osmond would be doing this. And once we're ready to start, the patient's lined up, he engages the system, and then it starts to treat. This particular phantom treatment may have 60 or 70 different angles, and that's right for about a brain treatment. A prostate patient might have 250 different angles that this machine goes to. So the more angles that you can spread the overall dose out equates to less side effects for the patient. So that's always a positive thing. Now there's also something called real-time imaging, and as you can see, we have 2 x-ray tubes mounted into the ceiling, and they shoot down to the patient at 45-degree angles. The receptors are in the floor, so that captures the image, and it shoots it back out to the control area where Osmond's sitting. So he's monitoring the patient's position during the whole treatment, and if there's any corrections that need to be made, he can do that from outside the room while the beam is on. So then that's called real-time imaging, and that's kind of what the accuracy of this machine, which has sub-millimeter accuracy, and the real-time imaging really is what sets this apart from any other piece of equipment out there on the market today. And with that tracking system, we use something called fiducial markers. We place those into the tumors, if it's a lung tumor, liver, pancreas, anything that moves with respiration or the prostate gland, and that allows us to track that during delivery and take images real time. Now, in this particular patient's case, we wouldn't use fiducials because this person is going to have a mask system on. So what we use to line up, we use bony anatomy. So we'll take x-rays and we'll pick out bony anatomy features and compare them, compare the live images to what the person had for the treatment planning and make sure they match and begin the treatment from there. This is a very ominous machine, and when I first saw this, if you were laying on the table, this can be pretty scary. So we want to try to make the patient be as comfortable as possible. We've also found out through trial and error that we used to mobilize the patients as much as possible and make them, in turn, were very uncomfortable. But because these treatments can last from half an hour to an hour and 15 minutes, we found out that less is better. So we started taking away these immobilization devices, and the person was more comfortable. And the more comfortable you can make a person, the more relaxed they are, then they tend to hold still for you.